Welcome back to another episode here on the Hart Hustle podcast. Our next guest, I love this line that she mentioned when we first spoke. She says, we're not just using technology to collect data, we're actually using it to give caregivers back their evenings so they can spend more time with their families and helping yours. Sheri, welcome.
Thank you. Pleasure to
What
be
a
here.
line. When we think about caregivers, and I love that you did kind of bring that up on just the technology aspect. I feel so many people have lost the passion for what they do because of all this admin and repetitive tasks that just need to be done on the back end. But you've understood that, and you're trying to get back that work-life balance. So kudos to you on that. But could you talk about the organization? What's the organization that you represent, and your role in this organization?
Sure, absolutely. I'll give you a little bit of background. I'm Sheri Strobel. I'm the Chief Information Officer at Chapters Health System. We're one of the largest nonprofit hospice end-of-life care organizations in our country. We currently are caring for over 6,000 patients a day across 6+ states, mostly in people's homes. So we do also have inpatient hospice units, which run very similar to a critical care unit in a hospital type setting. My job is to develop our team, develop our systems, and really enable our technology to support our caregivers across all of the different lines of business we have and at the bedside, as you've kind of referred to it as well too there. We're looking at ways we can do this that will provide the compassionate heart of hospice. That's what we're all in this business for, my organization, and not have the technology get in the way of providing that good compassionate care.
And this wasn't just something that you woke up and decided I'm going to do, because you actually had a pretty nice career. You go from that teenage nursing assistants to a CPA to CIO of one of the largest end-of-life care systems in the country, as you mentioned. So definitely not a straight line. What tied it all together, though? Like, what first drew you to healthcare as a teenager?
So, real brief, short story. One of our neighborhood families, I was their babysitter as a very young teen, and she happened to be an LPN at a continuous care retirement community that took care of the elderly, had an all-timer unit, and after working with her and her kids for a few years, helping when she was at work, she recommended me when I was 16 to be a certified nursing assistant, get a job there as well. So she inspired me to go into the healthcare realm. I give her a lot of credit and have been in that healthcare realm ever since. When I was a certified nursing assistant, I really realized the end-of-life care was such an impactful area for people, for their families. There was a woman I met there, one of the patients, last name was Pullman, and Louise Pullman was probably from the Pullman train company. You may have heard of it in school and growing up, Pullman cars. And it always was very influential to me and impactful to realize the woman who was at final stages of Alzheimer's, the story, the life that she must have led along the way. And realizing that these are people with real stories that are living their last couple of years with, unfortunately, tough diseases to work through. But their story, giving them compassion, giving them the quality and the dignity of life they deserve, and wanting to hear their stories, was always something that just inspired me along the way as well.
I love that. I love that life be lifing. We have these plans, and people just pour into us and really start to spark some interest that we've never even knew we had. I can imagine you didn't think you were going to be in this healthcare space, right? Like,
No, I
what did
didn't.
Sheri want to be before?
You said I went to school. My undergrad was in accounting, right? I graduated, I went off, and I worked in accounting for quite a few years. I ended up implementing a payroll HR system for them. Really got the technology bug in me. I learned how to write queries, which was, at the time, I was just tickled pink over and thrilled to see the power of what that could do to help from an accounting perspective. Then I got a phone call, and they were looking for someone to lead up area of applications for a senior living company. And I thought at the time, what does senior living need technology for? This seems really crazy. Well, it turned into be one of the greatest 20 years of my career working for that organization. And it really brought me back to realizing how technology can help the seniors, help the elderly, help those in memory care. Kind of brought me full circle, and once I realized the power of all of that, and still using my accounting finance background, to make sure the investments we're making are going to be good ones for the organization, and be able to relate to the finance team, relate to the others, and relate to the nurses. That's what kind of helped me, I think, draw me back in.
It's so good. Yeah, it's so good when you're able to really do the things that you love and mix those with other things that you love. And that's really what you loved something and you found another place that you love, and how do you merge those two together? And really you have that dual background in the finance and the tech. How do you think that kind of shaped your leadership?
Probably it makes me a double geek, right, on both sides of it. It's been hard though. I have learned that I am not a programmer. I didn't grow up with a computer science degree or a networking degree. So working with those folks in IT, I gained a lot of respect, asked a lot of questions, seeking to understand, right, and be able to partner together, but realizing I'm not the network expert. I'm not a nurse. I am not a doctor or physician. Kind of been in that in between both of those. So asking a lot of questions, seeking to understand, respecting others is really what helps guide me and help me along the way. So
And you talked about your career. You end up joining, if I'm not mistaken, chapters in February 2020, like really right before the pandemic, right before the world shifts right underneath our feet. What did that moment teach you about resilience and leadership? I mean, going through something where you start this new job and all of a sudden you're like, wait a minute, did I just get into this? What is next? Like, do I have a job? Like, what was your thoughts on that?
you're summing it up very well, right? Like so many of us at the time, right? What's going to happen? Is this going to be over in a few weeks? Is this like the flu? Or, we didn't really know in February. I moved myself 500 miles south from the Tennessee area down to Tampa,
Wow.
Florida. Our plans at the time were to kind of commute. I had previously had a job in both Milwaukee and in Nashville, Tennessee, so I thought, well, instead of going back and forth from Nashville to Tennessee,
Hmm.
I'll go from, because my family at the time was living in Tennessee, I'll go from Tennessee to Tampa. It'll still work out. Let our son graduate high school in a year and then relocate the family. Well, sure enough, a month into it, right, the whole world kind of became upside down and things changed. Resiliency, absolutely. I'm the new kid joining a team. Everyone's now remote. Building those relationships all remote is so different, right? And you roll up your sleeves, you start listening, respecting, and you try to accelerate, what you can do to help. But being that new person, I didn't come with that 20 years of experience to really provide value. It was difficult. I think I learned a lot in the speed course. Fortunately, have one of the best teams, one of the best leaders that I came to this organization to work with to help me out along the way and pull me in. But boy, was it a whirlwind. I hear you. If it would have been 1 month later, probably would not be in this place today. But I'm really
I
glad it worked out, and I'm glad the
No,
team
same.
gave me that patience and still welcomed me along the way. The new kid.
I love that. And we talk about technology, right? Like, how cool was it that we were all able to go instantly virtually? Telehealth, which was something that people were fighting and thought it would never work. Telehealth became a huge thing. Everyone switched overnight to telehealth. But just, yeah, you're in the space of technology. And when I talk about technology and the hospice is something, or even end of life, it's a conversation people don't have or don't want to have, but we'll all need it someday, right? How does technology actually help you change that conversation?
Oh, that's a good tough question along the way.
Yeah,
Um,
I'm putting you on the spot here,
Putting me on
Sherry.
there, right? So a lot of the areas of technology that we have been implementing have been focused probably on the areas around the bedside. Because for us, the bedside, I think I may have shared, is it's in someone's living room usually, right? There may
Hmm.
not be Wi-Fi. There may be a lot of background noise, dogs barking, people coming and going. It may be intimidating for some folks as to what's happening. They're already at a very challenging time in their family's life, dealing with loved ones in hospice or advanced illness care. And for us to be introducing some of those things is may work, may not work. So we've
Hmm.
started on more of the other areas, the probably the more traditional ones, the back office areas of technology, We've done a lot of work with trying to automate, get better analytics to provide better care, try to reduce things along the way. How we do it though at the bedside, we've got some new pilots going on and we're working through those, but it hasn't been easy. It hasn't been easy to build that trust with people that we're trying to help them do their jobs better. How do we reduce those clicks, right? Not
Yeah.
create more of where we started the conversation, that pajama time where they're working in the evenings, updating their charts, when they should be spending it with their family and relaxing or reading a good book. Those are how we've been trying to work through those challenges, work through the trust, work through the buy-in. And then it makes it really difficult because we aren't those frontline caregivers. We're
Yeah.
helping them, but we're not them. So having to partner, having to try to really listen, seek to understand what it is that we can embed in their workflows to make their lives better, that's what our goal and mission is.
And one of the things that you talk about, just allowing them to have that pajama time back and allowing them to, we talked a little earlier as well, doing the things they love more and the things that could be automated and repetitive tasks, we can give it to AI, right? And you've also said AI can't just be a hype. It has to deliver that real impact for caregivers. It's really important that we do. How are you rolling that out at Chapters? Or if you guys are even rolling it out? I think you may mention some pilot projects or something.
Yep. There's some areas around it that we're getting to. So physician notes, the physician tends to do more of a longer narrative note where we are using agentic AI tools there that are scribing that note, not just dictation, but it is actually summarizing it in more clinical terms, bringing in diagnosis codes, taking out maybe some of the conversation over last night's football game, or can I pet your dog? And it's
Yeah.
turning the note into what it needs to be appropriate for that. Where we need to go, though, is to make sure that AI does belong at the bedside when it helps that human be more human. So for the physician, it's working out pretty well, getting an agentic AI scribe note, and we're very excited about it. But our EMR for the nurses, social workers, chaplains, and the other caregivers, they have discrete fields. They don't just have a note. So finding a way where we can get that summary of the conversation safely and securely, that the patients are understanding what's being recorded and it's there to help everyone along the way and they're comfortable with it, they're giving permission, but then finding a way for all to go back in the discrete fields, right? Back in that EMR so the nurse can have the eye contact with the patient and have a discussion with the family, not staring at the computer and typing
Yeah.
it in for each field. That's, I think, the part that will really sink and make AI work at the bedside.
You being you mentioned a technology geek, right? Being in this space for 20 years, we've seen innovation happen and very fast. I mean, at one point we had what's called an iPod, and now it doesn't even exist. We got into social media almost 20 years ago, right? Facebook became real big, Instagram became real big, but now we have this new word AI, new technology AI. What was your first thoughts about AI when it actually implemented, and what is your thoughts now seeing AI and some of the things that it's doing, and not just in the beyond the front line care, but also on the back end of operations and revenue cycle and things like that?
I think everyone has a different take over their comfort level, their familiarity with it. When it becomes real and you actually can get a solution that can scale, that is sustainable, right? That's secure in healthcare. We just can't implement anything over the way. We've got to be respecting people's data, their privacy, where all this is going, right? And that it still can be simple to use and it's accurate. Those are the areas that my mind goes around of how is this new technology going to actually work and can we actually afford it, right? In our area of healthcare, that post-acute care, non-acute care space, our funding is so very different and our margins are so different that it's a dream, it's a pipeline, you can see it. You can get excited over the potential, trying to help build that trust with others, especially when I'm talking with our CFO, or well, we need to be able to fund these things, we need to be able to invest in them. And they're probably going to fail. More are going to fail than are succeed, but we'll learn from it and we'll get better along the way. That's different, right, than other people's take on what they can afford in their organization, what they can bring in and do. So for me, those areas of when I saw AI, my mind just becomes so open and excited over where it could go. And I think that seeking to understand and waiting, trying to find small wins. How do you find a win for someone? And you're going to explain to them that this may take over your workflow. This may take over the things you're doing. For some people, it's thrilling because I'm so overworked. Other people, now you're getting a bit personal, and now I'm getting scared and leery. So building that trust for me, and that's where I think a lot of our challenges that we've had in healthcare, is it going to be safe and secure? Is it going to take over my job? Are the robots, going to be now taking over the world? What's it going to look like? I think I heard in one webinar that I was listening to fairly early on that AI will not replace caregivers or doctors, right? But a doctor or caregiver that uses AI will replace one that does not. That, I think, is what resonated probably the most to me to try to help communicate and get others to understand. It's a tool. And then another great colleague of mine shared, when the stethoscope came out, did it replace the doctor? No, but it was a tool for the doctor to use to provide better care for patients. That's what AI means to me.
I love it. I think we're still in a space where a lot of people still have their guards up, and it's because they haven't got their hands in it yet. I think a lot of people that when they get their hands dirty and realize like, oh my God, this is actually really, really good. And just at the surface level, like a Copilot or a ChatGPT, that they really see how this is of value to them. Kind of to what you just mentioned, that you heard something about the AI space. So I don't know if you're familiar with Gary Vee, but Gary Vee says, when he started his career, he had someone following him with a camera, just filming his every day. And people thought that was crazy. But now there's so many people that have a camera guy that follow them around every single day. And he said that's exactly what's happening to the AI space. We'll have so much AI jobs out there, new jobs that are around AI. And the people that understand those jobs will get the jobs, ideally. It's not that we're replacing jobs, but we're becoming more efficient. I love AI in the space of, and I was just doing this with my team. They were really in shock. Like I created these AI and automations on the back end that you drop something in one folder and it'll produce something in the other folder. And they're both looking at me like, oh, this is great. But it was also buying them back time. Not only is it buying me back time, but allows them to do more of the things that they love, right? You don't have to now do all these different things, go here, go here. It's done for you, all at a click. So what I think though is that we're expecting our teams to adopt this. Why do you believe leaders need to use AI themselves before even having their teams adopt it?
Folks are looking at us as leaders and wanting to emulate, right? When they see us embracing change, embracing technology to help us, not replace us, but to help us and do our jobs better, it encourages, I think it inspires them to want to do their job better and find an easier way. And so for me, if we think we're too good to have to use Copilot to check our emails and revise it for us, or it's not needed for me, but I want you guys for it to find ways. How is that setting an example? So, and it's a tool for all. It would have been crazy to think today, right, that Excel's only for the accountants. It's not for anyone else. I think getting that analogy out there might help folks too along the way. Embrace it.
No, for
That's just
sure.
my own thoughts. So, and
No, I love it.
it's different for everybody, right? It's a tool. So how can we use these tools? And the only way we're going to be able to use them better and get that innovation out of them is by using them and learning, trying, piloting, learn from it. They're not all going to work, right? And that's about it.
I think people are very surprised when they start to tap into the space of, and I bring this up often, but I was speaking to a leader, and she was paying someone to create her tone and brand. And I was like, well, you can use ChatGPT and create your own brand and tone and all these different things. And her response to me was like, no, Efrain, I'm not going to use it. Oh, I'm so against it. And so many people tried. It's like social media. She brought it back to social media. Everyone's on social media, right? So I pulled up ChatGPT and I'm showing her, like, look, I can take this and I ask her questions and I'm prompting because it's all about prompting, right? Good data. Keenan would say, my co-partner would say that trash in, trash out. But if you actually put in some good information, you're going to get some good stuff back that really surprises you. So for 5 minutes, I'm just showing her. 5 minutes later, she's sharing her screen and she's using it. And then a week later, she emails me and she says, Efrain, thank you so much. like, I think I may be overusing this. And I'm like, there's no way you're overusing it. And I think it's just people are scared. People are scared. And that's just life. People don't like to get uncomfortable. And I think this is a place that we have to really get uncomfortable with and see the value within this tool, as you mentioned, because that's exactly what it is. And there's so many different tools, even on the back end. Like, we're talking about what's happening at the caregiver level. Do you have anything that you can talk about in the back end that people are very surprised could be utilized for?
Well, one, I want a quick comment back on what you
Hmm.
did for showing the person their brand. What you did is you made it real for them. You showed
Hmm.
them how it can help improve their life and made it a reality. That's what I think is going to be the most important area. So when we talk about the caregivers and you're asking me for examples of where it improved on the back end, is where you wanted to go with the question.
Hmm. Yeah.
Looking at workflows, I think I'm going to weave it into that part of it. The workflow piece is what has to be incorporated. And if you can find a way to make a part of that workflow that's happening naturally today improve and improve that person, improve the care they're giving, that's where I think it's going to be catching on. The the notes, getting the data in the EMR, right? That's a part of the care plan for somebody, and to make sure that others can help take care of them. How do we bring both of those things together is where it's really going to take off and help us. So I'm not quite
Exciting
sure
time.
if I answered that
No, no,
question.
that
I
was
think I
it.
got carried away thinking about your experience with
No, I love it.
helping
AI
them.
is such a fun topic,
It
and
is, isn't
I
it? It
love
gets your
that.
mind going in so many other areas. And I think the things we're struggling with today, we need to share those areas we're struggling, and be honest.
Mhm.
It is not a perfect tool, right? How often do you even just ask Siri to do something, or you'll say Sherry, and Siri kicks in, along
Yeah,
the way?
yeah,
It
yeah,
isn't perfect. Humans aren't perfect either. But
yeah.
that's why I think with the humans and the technology together, we'll find the areas where that tool is going to be useful for us,
I
right?
love
And how
it.
do we make that tool better? And just look at all the new versions that are coming out, the different tools that are being built. Even today, if something, if I'm looking at for a caregiver, isn't going to be scalable to help all 1,000 because the dollar amount of the investment for that
Hmm.
is just going to be overwhelming within time because things are changing so fast. Another 12 months, it may be a brand new tool that's a fraction of the price commodity wise and it's even more improved to be more accurate and better. So you got to stay close to it, give it time, and work with it.
If the Heart and Hustle podcast has ever sparked any idea or made you think differently, do us a favor. Make sure you guys share this, post it on LinkedIn, or even text that nonprofit friend that you just have. Whatever works, this is what keeps the conversation going and allows us to just grow this community together. Seriously, we appreciate you. You talk about months, but I ask you, how about the next 5 years? What's exciting about the next 5 years of healthcare technology, especially in this, not just AI, and AI may be the technology we're all talking about, but what does it look like for you next 5 years? What is exciting?
What excites me is if we can really help change the mindset over end of life and a better end of life care that we can provide. I know I'm not answering the question around technology, but technology is going to be an enabler for it. It's really going to allow our humans to be reducing the stress we all have in healthcare, reduce the hours that is being spent, pajama time at night, at weekends, answering calls throughout the day, answering calls reactive. Technology is going to get
Mhm.
it so that those digital workers are going to be able to look at the chart, answer phone calls if we need to, route the phone calls where they need to go, do more predictive work for our patients, our caregivers, and their families. And when we can become more predictive, change the mindset of end of life care, reduce that stress for our caregivers to let people want to come into this line of healthcare, it'll give back and really change, I think, the patient experience along the way. And that's
Mhm.
what I'm excited about. So it's that technology being the enabler. Gosh only knows in 5 years what that technology is going to look like. But I definitely want to be a part of it. I want my team leaders to be a part of it and the whole team to be a part of it.
My next question, I think you just answered it, was really what will the next generation of caregivers inherit, because of the groundwork you're laying now? And I think you just you just made sense of it all. It's adding those things that are going to allow people to really probably come back into this work field. Pandemic obviously took a lot of people out because of exactly what we're talking about. They didn't have enough pajama time. They were doing things they did not go to school for. Like when we go to school for something, it's because we truly love it. And when you put things on our plate that we don't love, it becomes not fun anymore. It doesn't become peaceful, purposeful. So I love that you're really laying this groundwork for the next generation of healthcare leaders, and helping them become more efficient at their job, but also love again what they do. So that's pretty cool. But you believe it or not, like there's still like my mom. I said, "Mom, do you use ChatGPT?" And she's like, "What the hell is that?" And I'm like, "You don't know about it?" And then, I don't even know if she's using AI at her job. And even my mother-in-law, I'm like, "What are you guys doing AI wise?" And she's kind of in the, I guess the nursing side, not at home care, but I guess the hospice where they're in a center, right? What would you call that? I'm not a
An
genius in
inpatient
healthcare.
unit, or is she in a
That's it.
hospice
Yeah.
house type of a
She's a hospice house, more of a
hospice house?
hospice house. And they're not using technology. And I'm like, what? Like, why not? So there's people that are really adapting a little slower, but I'm happy that you guys are ahead of the game. That's what's going to really help you guys continue to increase the number of locations, the number of places that you guys are going to be in because of the technology that you guys are building now. So I'm excited to see where you guys continue to move, Sherry. But if we can kind of talk about the end of life care, it's something that every family will face. And I love that you're in a different seat, because I do speak to a lot of those that may either be at the CEO level and maybe have a lot of experience here. But someone like yourself that is in the CIO, that is technology, that is more in the IT realm, how do you want people to think differently about it, about hospice and the end of life?
The mindset of hospice, of so many people that I talk to when I share the line of work of healthcare that I'm in, their initial
Hmm.
reaction is, "Oh, I'm so sorry. That must be a really hard job." And it is a hard job, right? Healthcare is a hard job. Jobs these days are hard everywhere you go. What I really want people to do is have a better understanding that we can make your end of life be what you want it to be. It's still living in its life, and we're going to give you the best health care, the best care overall. And I think getting the people to realize that, maybe Jimmy Carter might have helped. He was on hospice for quite a long time. And you don't go to hospice to die. You go to hospice to live better, to live the life that you want to live. Helping change that mindset, and we're going to do it through my tool. My toolbox is technology and enabling our caregivers to do it better. Everyone that we work with in our organization has a different tool that they're using to do that. For me, being able to change that mindset would be wonderful. Give you one little quick example if you still have time. I was
Yeah.
on vacation recently in Scotland, and we were up in the Highlands, and we were doing a walk just outside of our hotel, and I ran into a hospice house. I was shocked. I'm like, in Scotland, we gotta go in. My family's very much used to when we go on vacation, we visit one of our locations. Throughout my previous organization, had locations in almost every state, so there was usually a chance to visit a caregiving setting, and very used to that. And we stopped in and speaking with the women that were there, around the world in a completely different healthcare system of England, right? Very different. We had the same challenges, we had the same aspirations, and the same hospice heart. And listening to them, and I'm like, what is the, I asked them, I think that question, what's the one thing you'd like to change? And that's people's opinions of what hospice healthcare can do, what they can do for your loved ones, and how we help the family. And get that mindset that it's open to talk about. It's hard talking about death.
Mm.
And if we can get a better sense of talking about how you want to live your life, what does that look like? And make it an easier conversation so we know what our loved ones want and we can improve their life, throughout with wherever stage they're at. That's just going to drive that passion. It's going to drive improvements in our society all the way around. I know it may sound a
I
little
love it.
lofty here along the way, but it does get exciting to think about how we can kind of change the culture, right? And change the mindset
Yeah.
for folks to improve it. A tough
I
situation.
love that you're so passionate that even in another country, you're going to go experience what hospice looks like. Because you can imagine you bring all these ideas and these visions back to your own organization. How do we be better? How do we compete? That's how you know you love what you do, right? Like it's not even work for you. It's not about the paycheck. It's about the purpose and the passion. And I love that. And we really didn't get to talk a lot, like because you're in your seat, but I've heard some amazing things that are happening, such as VR, right? People, I heard one story that someone wanted to skydive, and they say, well, I mean, you're in a space where you really cannot skydive. You're 87 years old. You know, you have these things going on internally. And his response was, George Bush did it. And he's like, yeah, well, you know, he didn't have what you have. But what they did is put him in a VR and allowed him to experience that. I had another lady share how there was a gentleman, he wanted to shoot a bear before he passed away. And she's like, well, we have to work towards that. And it was morphine, right? And the kids were like, no, I don't want it to happen. But she was like, like, you know, we'll give you dosages. You can take with a button. I'm guessing that you could just take as much as you want. And weeks later, he was able to go shoot a bear. And then he didn't get a bear shot that day. But then I think like 2 weeks later, he went with his other child, didn't get a bear. The next child, weeks later, they got a bear. And then weeks later, he passed away, but he passed away doing what he wanted to do.
Wish we
And
were
that's
there.
what hospice and that's what these organizations, when we talk about just doing whatever it takes to allow people to live their end of life happy, doing the things that we love and they thought were never possible again, there's technology to do, and there's people that care, like Sheri, that's going to try to make anything happen through a little bit of innovation and a little bit of just thinking outside the box. So you're in a sweet spot. I think, I know you're talking about, you know, I think what's your space? You're a geek in two things or whatever it was.
Double.
It's a good thing to have, right? It's a good thing to be, actually. I love that. I just love the excitement that you bring to this field that a lot of people kind of cringe when they hear hospice and end of life. But you're just so excited to just keep growing this, and I love it. Um, Before we start wrapping up, where can people find you? Maybe on LinkedIn, but also the organization. They want to know more information.
Yeah. Chapters Health System it's becoming a larger health system. We are growing. When I mentioned that 6+ states, so you may not have known us in your community because we're often community branded, like a Life Path Hospice or Capital Caring or others. So being a larger complex healthcare system, easy to look up chaptershealth.org and check us out and learn. Maybe perhaps near you we do have a uniquely community branded name. I'm on LinkedIn. My contact information's out there. Please feel free to connect along the way. And I love talking about your goals, your dreams, what you're struggling with. We all realize, right? Technology challenges are technology challenges. And leading teams to work through it these days with limited budgets, right? Ever flowing list of requests and backlogs and things like that, and trying to prioritize and just trying to build relationships. You know, it is not easy. And if you don't build a relationship, you're not going to get the trust. You're
You're not
not going to
growing.
get the chance to solve, you know. So please, look me up. I'd love to hear how I can help you, and probably more importantly, how you can help your team help others along the way. We don't always have the answers, right? But we do have the ability to listen and be
Yeah,
empathetic and support.
I love it. Well, Cher, are you ready to get in the hot seat? I got a blind question for you. Are you ready? I know some of these questions you're like, what? I already had the hot seat question multiple times here. No, this is the blind question to end this all off for us. When you look back at your journey from that nursing assistant to the CIO, what's the one choice you think you made that changed everything for you, even if it didn't feel like it at that time?
Willing to do something someone said you weren't qualified for. So, being told no, that, you know, you don't have enough years of experience, you're too young at the time. And
Yeah.
that was what comes back to my initial reaction. And the manager at the time told the recruiter that she's too young. Now I look back and be like, but I stayed with this manager, been a good relationship with him for decades along the way. And I'm so glad I didn't take no for an answer, or it's not going to
Yeah.
work for you. So sometimes the timing might not be right, might not be the right organization. But if it's something that you believe in, lean in to whatever that looks like to make it happen at the right place, because it's there's going to be something out there that's meant to be. So
Yeah. And sometimes hearing that, it's like it's so easy to take that in the wrong context and be like, "What do you mean?" But sometimes that's just almost confirmation that we need to move on. Sometimes, because I've had those experiences plenty of times, and I've been in leadership since I was 19 years old. I was running my first store at 19 years old with a staff of like seven, and the
As a
store making.
teenager?
Yeah, a general manager. Yeah, I was a general manager, and I did that for 7, 8 years at Subway. And I don't know if you ever seen the show Undercover Boss, but I had a lot of great opportunities through it. I even as I was working at Subway, I had my own restaurant working. So I was working 6 to 4, and then I would work 5 to 2 in the morning, and I was doing that for some time. And then when life was lifing, I decided to close my cafe because I was doing so well with Subway. So I remember going to the new CEO. She was HR for about 25 years, and I said, "Hey, I want to do more. Like I cannot be continued to be contained in these boxes, these four walls, right? You've asked me to go to this location. I've done what I needed to do. You asked me to go help this person. I've done that." And she says, "Well, I waited 25 years for my opportunity, Efrain. You have to wait for yours." And I'm young. I'm like, what? You think I'm gonna wait 25 years in this box? And that was what I needed. I asked God to give me a sign if this is where I need to stay, and He gave me a clear sign, and I walked away. And I tell you what, I'm happy that I did. So at the moment, of course, I was a little upset that she said that to me. Now I look back and I'm like, thank you that she said that to me, right? Because I would still been at Subway probably inside some boxes, just maybe not one. I had probably multiple stores. So I love that you took that and you, as you mentioned, you didn't take no for an answer. You kept going on the things that you love and that you cared for. So, Sherry, I appreciate your time. You
Oh,
have
you're
been
fine.
amazing. I know that we're going to do this again. I know that next time we talk, we're going to see so much growth in the innovation and the AI space because you guys are already kind of ahead of the game when I speak to other leaders. But if you guys are still watching, make sure that you guys do like, subscribe, comment, find Sherry. She's always willing to answer those questions. And if you want her to just visit your hospice location, she's down to do that as well, right?
Please
Sherry's
do.
down to go make those
Please
visits when
do.
she's in town. Guys, thank you guys so much for watching. This is Efrain with Sherry. We'll catch you guys on the next episode.
Thank
Laters.
you. Take care.